Hi, my name is Mohammed Irampak. In this video, I'm going to represent my learning in body fluids and in urinary system. And in this video, I need to answer a few questions regarding my physiological function, particularly in balancing my body fluid. First of all, it said, what was your total fluid intake in 24 hours? The body intake for fluid intake formula is really clear and very easy. So, um, because this formula is very, I think it's not readable in the image, in the paper, but I have to read it. So my age is 34 and my weight is 100 kilos. And for this amount, the formula is the water intake is 1500 ml plus my weight times 20 ml per kilogram per day. In which is for me, if I want to calculate that with it would be around 3500 milliliter per day. So, and if I want to calculate the infusion rate, I need to divide this amount by 24 because the day is 24 hours, and it would be around 150 milliliter per hour, my infusion rate. And the other question is, what are the source of the fluid intake? Fluid can be water intake can be done in different ways. For instance, by through the foods, the juice, drinks, water sources, and the things that we get for in our daily life, and also water intake can be done through some reaction, the output of some reaction in metabolism. But the alcohol is not a source of the water because it's diuretic uh, liquid. And what is the total urine output? The total urine output has a easy formula. It's the amount of urine per number of hours divided by weight of our body per kilogram. For instance, if I measure my urine in 1 hour, I have 200 mil or 150 mil or 100 milliliter, and in 1 hour time divided by my weight. My weight is 100 kilo. 100 over 100, which means 1. What does it mean? It means 1 milliliter uh, per kilogram per hour. That is really easy, but this amount should be considered for different use and different criteria. And what are the routes? What are other routes of fluid loss in our body? Fluid can leave the body in different ways: urination, excretion, which is through the feces, and perspiration, which means sweating, and we release the water out of our body. What happens when the fluid output exceeds the fluid intake, and what would the cell osmolarity be affected? So when the water exceeds the intake amount of our body, blood volume decrease and plasma osmolarity increase. That leads to dehydration. So the reduction in the blood volume decrease the blood pressure, which leads to uh, increase in renin and angiotensin 2 concentration. And this was very easy and clear and cod concepts that I learned, and it was really interesting to notice. On the top of this, because of my job in MRI, and we have to inject contrast, which is gadolinium, and our patient must have good GFR. I think I already know a kind of glomerulus functional rate or GFR, and also it's very good things to know for the kidney functioning things. And I'm so happy to represent this video.